to the bank. I'm recording. Everybody be good. Vicki Kirkpatrick.
Hi, I'm Vicki Kirkpatrick, and I'm Director of Jefferson County Public Health.
And Vicki, you do have one more meeting with us, right?
Yes.
Yes, one more. Okay.
One more.
And I know that's why she made her end date when she did, was just so that she could be sure to attend this last meeting. Yeah. Chief Olson.
Tom Olson, Chief of Police, Port Townsend.
And Apple.
Apple Martin. I am the Community Health Division Director at Jefferson County Public Health.
And she's not saying it, but she will step into Vicki's role here in the next couple months. Jim.
Jim Novelli, Executive Director, Discovery Behavioral Healthcare.
Good to have you. Gabby.
I am Gabby Caudell. I'm the Clinical Supervisor of Believe in Recovery and the RSAT program at the jail.
Thank you. Jolene.
I'm Jolene Kron, Deputy Administrator, Clinical Director with the Salish Behavioral Health Administrative Services Organization.
That is such a mouthful every time you say it.
Much practiced, you can tell.
Dunya Fo, Jefferson Healthcare Director of Population Health and Care Transformation.
Great, thanks for being here, Dunya. Beth.
Oh, I'm Beth Myers, Mat Care Navigator Coordinator here at Jefferson Healthcare.
Good to have you.
Thank you.
Okay, I'm going to share my screen quickly. And then I'm going to try to make it so I can also see everybody. Okay, can you folks see the screen? The PowerPoint? Great. Today we have a couple of things. Jolene going to give us some updates and host some Q&A if there's any of that for her. Then Kelli Parcher is going to join us and give an overview of the new Pfeiffer House project. And we'll give you some updates. If there's any time, we'll give you a quick teaser about the OCH stigma assessment results. And with that, I think we'll jump. Oh, again, any of you, if you've got a success or a challenge or both that you could note in the chat box that you or your organization has had over the past 3 months related to prevention, treatment, and or recovery, I'd welcome you typing it in there so that I have some feedback from you that I can incorporate into the many reports that I'm giving to HRSA here at the end of September. Okay, and with that, I'm going to pass it over to Jolene. Yes, I do see Jolene. Okay, Jolene, you let me know as you want a slide advanced.
Okay. So just following up on some of the information, and Lori was at our executive board meeting and felt it would be helpful to bring some of this information here to the BHC. So just kind of wanted to talk about where things are at with House Bill 1310 and the impact that is having on the crisis system. I know we've talked before. House Bill 1310 is related to law enforcement use of force, and some of the impacts that we are seeing with the interpretation of this bill across the state. And these conversations are, I think, at every level now. Does everybody understand what's going on with House Bill 1310, or do I need to give a little bit of background?
Give some
Maybe
background.
Yeah, a little bit of background might benefit some of us.
So ultimately, House Bill 1310 prescribes to law enforcement restrictions related to undue force or use of force with individuals within the community. The way that we are seeing that impact the crisis system is an interpretation related to use of force with individuals under what is known as RCW 7105, the Involuntary Treatment Act. And so we are seeing challenges So historically, law enforcement provided safety support, and currently, I want to be clear, in our region is still doing that. So safety support now primarily in a secondary role. So crisis teams have relied strongly on law enforcement to provide backup for them. And they would provide often transportation for individuals who needed to be transported to an emergency department, or working with EMS to provide that transport. They would also pick up individuals who were on what they call a pickup order or a non-emergent detention order. So if it was determined that an individual needed to be evaluated or gain medical clearance for involuntary treatment on a non-emergent basis, law enforcement was able to assist in transporting those individuals, or when they were located, sometimes the non-emergent detention would happen because an individual couldn't be located. And so when they were located, they would then be transported. Next slide. So currently what has happened with House Bill 1310 is we have kind of seen a disruption in that process, and the interpretation around what that role would entail from law enforcement has been vacillating. And so we are seeing across the state, I would like to say, we have done some work within our region I'll speak to very specifically, but across the state, some of the consequences that we have seen as recently as in the news this morning is some law enforcement jurisdictions are not responding at all if they are informed that it is a behavioral health call. Some are responding but acting only in an observational role, standing in the back and not engaging, responding, but then leaving if no crime is committed or imminent risk, which seems reasonable in many situations. But one of the big challenges is no longer providing transport. And there are some EMS who will not also provide transport if law enforcement is not on scene when they arrive to do so. And again, a lot of that has to do with legal requirements about people's rights and detentions and holds and those kinds of things. Next slide. This is a busy slide. So again, there is some variation and there is disagreement in many venues as to how this impacts what I refer to as RCW 7105 and the interpretation of imminent risk and danger by mental health professionals versus law enforcement has been, I mean, it definitely can be a different interpretation of what those words mean. Imminent risk could mean right now in this moment. Imminent risk, could to someone mean, within the next 24 hours, this could happen. And so we are seeing some of those language challenges. And so this has led to some concerns about crisis teams having to go out without law enforcement backup and support. Situations where an individual, even when they are detained, they're unable to get them to an emergency department, ultimately spending time presenting, trying to get the individual to voluntarily go in the ambulance, even for an involuntary detention, and ultimately could lead to leaving an individual who met detention criteria in the community if they cannot do that with an escalation of behaviors. I would like to be very clear that in our region, we are working with our crisis teams and our law enforcement. We have reached out and gotten information as to the stance of every as many of the jurisdictions, law enforcement jurisdictions in our region. We are overwhelmingly positive In the response, most of our jurisdictions have been very clear, and that included tribal jurisdictions. We reached out to everyone that law enforcement will respond to provide support and backup, but primarily on that observational role and looking at imminent risk. So the expectation would be that the crisis team would be the primary to engage. And we are seeing that. We have seen a couple of situations where an individual detention did occur and transportation became the largest barrier because of the use of force and law enforcement not being hands-on based on the interpretation of House Bill 1310. Next slide. Oh, that's that one. So let's go back one, Lori, if we could, just want to make sure. So just want to be really clear that what we are, that we are working with the teams. We are also trying to work with law enforcement. We have invited all jurisdictions to a meeting next week, just so we can have a roundtable about where things are at, kind of strategize how to manage that. Each of our crisis agencies have been meeting with their law enforcement, but we just wanted to bring this update to the table. Again, as I said, this is being discussed on every level. There have been many statements issued by many entities related to House Bill 1310 and its interpretation. There has been a request of the AG's office, is what we've heard most recently, to weigh in. They did issue a statement, but it was not a formal statement. And so we are still experiencing challenges around this situation. And so are there any questions related to kind of what's going on around House Bill 1310? I know it's a lot of information.
Jolene, you might go back and you covered this very briefly, but the original intent was to do what?
So the original intent is to limit use of force and use the least restrictive de-escalation interventions possible on the side of law enforcement. That was the original intent of House Bill 1310. Yeah.
Jolene, what's the role of law enforcement navigators in this process, and are they subject to the same regulations as the law enforcement?
I think that is a great question that they may be able to better answer. So we also have met with the navigators as well, related to some other programs, but we are hearing from some jurisdictions that they would dispatch the navigator to provide some of the support if needed to a mobile crisis outreach team or to engage. Those individuals have never, as far as we are aware, been allowed any use of force, so it wouldn't apply to them in that way. But again, it is up to each jurisdiction. So therefore, each navigator program as to how they would choose to respond. We do know that we are seeing some of those navigators participating and continuing to participate in mobile crisis outreach and community interventions. Any other questions? Okay, next slide. Another slide from our executive board that Lori thought would be helpful just for us to share. So the SBH-ASO, we did our quality management program evaluation for the year of 2020, and these were some of the achievements and areas of focus that we pulled out. So in 2020, we did complete our first year as the ASO in the middle of a pandemic. So not only did we roll into a new program, but you know, we just thought that wasn't difficult enough to change the majority of our scope of work. So, you know, throw a pandemic on top of it. We did implement the Salish Regional Crisis Line effective January 1st, 2020. I think one of the interesting call outs for that is we received almost an average of twice the number of expected calls for the majority of 2020. That led to some changes and increases in that contract as we identified that the projected needs from the previous crisis line that was volunteer and the number of calls coming in to this line, again, we're almost double consistently for the entire year. We also underwent the development and implementation of a fully new utilization management program, and that became necessary to be able to manage the limited resources related to the non-Medicaid funding stream. And our care managers have done a fantastic job of meeting metrics and monitoring and providing care coordination. A big piece of this relates to involuntary treatment, inpatient stays, and coordinating care for those high need folks. And then we also had a successful maintenance of our operations and provider support, despite moving fully to work from home in mid-March of 2020. Our entire team had been working from home until July 12th. Actually, we're back half-time, but we were able to continue to provide services to the community, continue solid operations and relationships and support to our community and providers. So our areas of focus for 2021 is increased monitoring of over and underutilization of services, both for the non-Medicaid population and also for folks accessing crisis services from the Medicaid population. And so working to provide better community coordination and ongoing support in that arena, and then continuing the monitoring of the crisis line performance for 2021. Any questions about that?
I just want to say it's an enormous amount that you guys have accomplished. And every time I go to another one of your board meetings, I am just boggled by how much you guys get done and how much you are riding herd over.
Thank you. So an update on our the block grant RFP that was released on July 6th. It remained open. It was open to our network. It was shared across the current network, our additional community partners, publicly in the newspaper and on the Kitsap County Purchasing website. We released $555,000 for substance use disorder under the substance abuse block grant, and $250,000 for mental health block grant. We did a mandatory bidders conference, which individuals who were interested in submitting proposals would have to attend that in order to submit the proposal so that they could be successful in making sure the information was accurate. We had 9 agencies attend that bidders conference. We had 4 agencies submit under substance abuse block grant. Those 4 agencies submitted for 12 different programs, as we have certain priority categories for substance abuse block grant. We received 0 proposals under the mental health block grant side. And so that did close just last Thursday. So this is new information. So the determination of any unallocated funds will be pending. Our current process is that our advisory board is currently in review of the proposals that were submitted, and we will be meeting on August 30th to provide recommendations from our advisory board that will be presented to the executive board in September. And at that time, hopefully we will have some additional recommendations related to any funding that was not requested. So the requested substance use block grant funds was approximately $100,000 less than what we had available. And again, there were no requests for the $250,000 of mental health block grant that we had available. Any questions on that?
Jolene, if I may, would school mental health programs be eligible for the mental health block grant?
So these are enhanced block grant funds, and we did include in our direct outreach, we included OESD. So they were informed that these funds were available, particularly related to training resources as well, which was a priority Generally, when we see the school services programs, they would need to go through a licensed behavioral health agency, but it could fund those programs that would be in a school.
And for instance, a public health could not, on behalf of a school-based health clinic that offers mental health services, they could not do that because public health isn't. Is that true?
Correct. They would need to be able to meet the data requirements and be a licensed behavioral health agency.
Okay.
When it comes to treatment-based services, we also kind of split the RFP this time. So we had treatment-based services and recovery support services, and recovery support services. So trainings, those kinds of things could be provided entities that were not behavioral health agencies. So that funding was available to those groups as well. Any other questions? Okay. CJTA, the Criminal Justice Treatment Account. Just to make sure everybody knows what that is, the Criminal Justice Treatment Account historically was used primarily for treatment and urinalysis until 2014 with the expansion of Medicaid and substance use disorder individuals having access to Medicaid coverage. We have seen kind of a shift for a Criminal Justice Treatment Account, which provides services and recovery supports to individuals who have criminal involvement and is closely tied to work with drug courts in each county. Each county has the option to manage those funds or defer those to the ASO for management. Jefferson County, well, actually all three of the counties we work with, so Jefferson, Kitsap, and Qualam, defer the administration of CJTA to the ASO at this point. So right now we are seeing the spending for Jefferson County for 2021 is below expected. And so that was discussed at committee last week. Some of those challenges are related to COVID and also changes related to the Blake decision, which made simple possession charges void for many individuals across the state of Washington. So it has decreased the number of individuals in drug court or the number of individuals who would have needed services funded under CJTA, which does cover only the non-Medicaid population. Medicaid enrolled individuals treatment is covered under Medicaid, even for individuals who are involved in drug court for the most part. So the BHC-ASO, we released an SUD needs survey to all three counties, and just wanted to give you kind of the preliminary. There is a report available on our website if you're interested in a more expansive information. We received 301 responses across the region, and 14 of those responses were from Jefferson County. And that included family members, treatment providers, individuals in recovery. We cast our net as widely as we can. Again, if you want more information on those populations, it is in the report. And the treatment needs identified for Jefferson County were outpatient treatment, case management, and youth services, and MAT were tied for third, so medication assisted treatment. And recovery support needs identified, again, specific to Jefferson County, were housing supports, and housing supports were number one as a recovery support need across all three counties, very clearly. Transportation was the second need, and then relapse prevention and childcare tied for third in Jefferson County. And the intent of this needs survey is to help inform our advisory boards as well as the CJTA committee to identify the community priorities. So again, we do break that down in the report. Interestingly, the needs seem to be fairly consistent across populations as well. So those in recovery, family members, care providers, and law enforcement all felt like housing support was the primary need. But you can look at that report if you would like additional information. Any questions on criminal justice treatment account? All right, last one. Okay, Recovery Navigator Program update. So the Recovery Navigator Program is a requirement under the Blake bill that provides community outreach and case management for individuals who have SUD, co-occurring disorders, or mental health conditions, to provide referral and support to get folks to treatment. This closely ties in with the law enforcement requirement to refer twice prior to any legal intervention. So we've been talking about this program coming. We've been waiting and waiting. The uniform standards draft, we do expect the final version in the next week or two. We have been able to provide feedback on the uniform standards. So there are 2 ASO representatives on the stakeholder committee at the state level. The uniform standards are something that they seem doable, let's put it that way. And so the program itself is very lead driven. So it's a very lead-like program. So law enforcement assisted diversion was the original acronym for that. And the focus is really helping law enforcement have a referral source and then providing really on the ground based outreach. The expectation is the outreach workers will work 90% of the time in the community in areas where marginalized individuals are known to be, to try to engage folks at the level where they're at and provide any support and services that they are interested in at that time, and build those relationships that would hopefully over time help individuals be able to access other treatment services and supports. We do not at this point still have specific funding information. We do expect that to come with the uniform standards final draft. So hopefully within the next couple of weeks. We did put out a request for letters of interest from our current network. And they have until tomorrow to provide those to us. So then we would know who is interested in possibly providing these services across our region. And that will inform whether we need to do a request for proposal procurement process or just provide direct contracts. There is a quick timeline for this program. We are required to provide on September 1st a report to the state on progress, and October 1st, a final plan, and hoping to have individuals in place. And when I say hoping, that would be the healthcare authorities hope to have individuals hired in these positions November 1st. We all know that is a very tricky timeline, particularly with the workforce issues we're seeing statewide. But we are doing our best to try to get to where we need to be with this program and be able to roll it out as quickly as possible. And just to be clear that this program is expected to be ongoing. The funding is written into the budget as ongoing. It is supported for this biennium fully. And then we are being told by the supporting legislators that they expect that this will continue as an outreach program across the state. So it is being provided in each ASO across the state. Any questions about that?
I had a question. So is the sense that there will be an individual that's in each region, I mean, in each county, or is it just one regional position, or is that really not known as yet?
The expectation is available to each community. Again, all of that will depend on funding and the finalization of the uniform standards and how we are able to develop that program. That program, that our proposal on that program would then have to be approved by the state as to how we break that out. We always do our best to cover as much of the 3 counties as we can and provide those. Some of the structure, if you're looking at a more urban area, you know, there's a program manager and a case manager and 2 outreach workers. And we know that model isn't necessarily going to translate the same across all of our regions. But I'm hopeful that once those uniform standards are completely finalized, we will be able to develop a plan, particularly when we know who is interested in how those services can be provided.
Got it, thanks.
Jolene, this is Lisa. I'm really sorry I'm late. I left another meeting because I missed you guys so much. And I might have missed this. Are there going to be levels of training / certification / licensure attached to the Navigator program?
So the current expectations are that licensure will not be required. There is a tremendous push, and in the current uniform standards, that the individuals, particularly the ones providing street outreach, are individuals with lived experience. So we would hope to get those folks certified as peers as well. So we are actually at the ASO working right now to sponsor a peer counselor training within our region to be able to make sure folks are in our region who would like to be certified peers in the state of Washington have access. So that is very exciting, but the expectation is that those folks have lived experience there. People will not be screened out based on their educational level.
Cool, thank you. And as usual, the Salish BHC-ASO is in the lead, doing great work.
Doing what we can.
All right.
Any other questions? Okay. Well, thank you
so much.
Jump off to another meeting, but I appreciate being able to share. And if there are questions that come up, please just let me know.
Thank you so much. There is a great deal in there. I'm sure some of us will be going back to the video on that one, and we'll look forward to updates going forward. I appreciate all that information.
Thank you so much.
Okay, bye-bye, Jolene. I just realized I have a message from Kelli Parcher where she's having trouble getting into the meeting, so I'm going to skip forward.
I'm here, Lori, actually.
Oh, you are here. Sorry.
I got some, I hit some other people up and jumped in.
Thank you so much for being creative on that front.
Yeah, thanks. I've got people.
Okay, so moving on to Kelli and the Pfeiffer House. I asked Kelli to come here because I have watched, particularly being on the Affordable Housing Task Force, the progress of this project that she's had with the Pfeiffer House go from an idea about a year ago, an idea with some good planning behind it, to where we are right now, which is a reality. And I wanted to ask Kelli to come here and give us a bit of overview of what's going on with that project. And I'll turn it over to you, Kelli.
Perfect. Thank you. Yeah, thank you guys for having me. So there's definitely some familiar faces on here, some that may have just heard the spiel from yesterday, but I'm going to hit you again with some information because we're pretty excited about the opportunity. So the idea, not necessarily around the Pfeiffer House in particular, but the idea of housing and working with that young adult population, which they still identify as youth in the housing world, of that 18 to 24-year-old, has been a topic in our community and a gap in our community for quite some time. So I like to say, as all the stars lined up, timing really worked out as far as potential access to some funding. The building space itself originally, or does still currently, belong to OLECAP, and they were ready to really kind of transition and do something different with that. So we, and this is a conglomeration of people, wanted to move forward with making housing possible for those most at-risk unhoused population of 18 to 24-year-olds. So we did just that. And it really just started with receiving funds from 148 and 149. The biggest process of this project originally was the rehabbing of the building. It was an 1888 building that's been in possession of OLECAP for quite some time, and for a number of reasons needed a lot of love and attention. There was a lot of deferred maintenance and just a clientele that was really not working in the community or caring for the property at all. So we really spent probably a few months working on completely rehabbing and restoring that building. And when I say completely, we're far from that, but we're at to the point where we have some residents. There's still some major renovation that needs to happen. But as you can see, our timeline really, once we received those local funds, we on the 15th started work, and by mid-July, we had completed every unit. So there are 6 units in the house. They're all individual apartments, full kitchens, a single bedroom, full bathroom, tub, shower, and living space. And we basically opened our doors once we received that unit inspection from Coordinated Entry, which are all folks living, under 30% AMI. We were full within 7 days. And we have, and Lori, if you can just pop to the next slide. So I guess in short, the need for housing for that particular population is true for everybody in our county. We have a housing crisis in our community. What our intention is trying to really remove and protect and treat those 18 to 24-year-olds different than maybe a way we may be working with that older population of adults, just simply based on brain development and their needs and their skill level and kind of their programming and where you go from here. And to protect them in some sort of sense, a little bit differently than how you're working with that older population.
Kelly, I noticed that Matt had a question.
Oh, sorry, Matt, go ahead.
I was just curious where it is.
Yeah, great question. Thank you. So it's on the corner of Lawrence and Taylor. So if you're familiar with the Jefferson County Rec Center and Aldridge's, we're right there on the corner. That picture that Lori has up there was, I don't know, many moons ago kind of looked, and now we have rehabbed it. So that's its location. It's perfect, right? It's ideal. We have a transit stop right in front of the house for our young folks. It has really, most of these folks were out in the county a pretty far distance without any vehicular transportation or modes of communication. So to move them right within the city limits where typically they were seeking services or seeking employment, has just in this very short time allowed these young folks to just blossom, right where they have been placed. Our current population right now that we have in the house is, we have 3 young males in the house, and some of these people are co-bunked or partners together that are 18 to 24-year-olds. We have 4 females, 19 to 23. We have 1 brand new baby boy in the house, and that child was actually able to really transition from the hospital into our unit, as opposed to going to an RV that had no running water or toilet or septic system at all in it, as well as a 2-year-old child. And then we have 1 expecting mother in our residence as well. All of these folks that are in the house have signed a 1-year lease with the possibility for an extension depending on their subsidy supports, where they are kind of with the programming. The Pfeiffer House is really housing first. That is the priority of it, but we are also a new emerging agency where we also firmly believe in programming. So I think someone was just mentioning it, right, that it has shown throughout our county that housing is our priority. But along with that, if we don't have the housing, once you have the housing, you have to have programmings to make them progressive and allow them that support to be able to move forward. And we are doing just that by having a very part-time case manager on site, as well as we have a part-time, if you will, mental health professional that's on site that's funded by 0.1%, very limited hours, which in our 16 days or whatever we've been open now, I can already tell that he's going to run out of his hours. Almost every one of our residents by volunteer have chosen to access his services. And so it's a real need and an awareness that, they're looking for that engagement and support. And now that they can have it there in their facility, because we have one of the units is actually our resource center. And that kind of maybe we'll get into possibly why Lori invited me to this thing. So we have 5 living units, and one of our units is our resource center. So the resource center is not only going to be for the residents to, as themselves, bond as a community, get connected in positive pro-social relationships with one another, but it's also to allow community providers to come in and provide programming from education to employment to mental health to medical, basic resources, as well as even expanding that. When we talk about that young population, you know, I also don't want to forget ticking down the road of those younger kids too. So really we are looking at the 16 to 24-year-old population and allowing those doors to be open so people that aren't residing in the resident can also still access some of the resources that are within that space or may become available to them. So in the short time that we have had the residents in the house, these are really some of the things that we've just started with on site that's happening with them. And you guys can kind of see for yourself, all these things that I've listed on site are things that we've actually already supported some of the young adults in. There are a few over to on the right-hand side of community connections. Of course, some of them come with those already and have lost connections one way or another. And we're just working on really getting them re-engaged now that they're finding some stability in their housing situation to be able to really re-engage back in programming and healthy and safety choices. How do we contact you? Well, you contact me by reaching out. It's a good question. So I can put my information or have Lori share that with you. One thing that I will say is currently, and this is just for 3 of the agencies in our community, folks can get referred either by a self-referral to the program, word of mouth, right? Jefferson County, that happens pretty quickly. Any type of provider can send us a referral from public health to mental health to substance counseling, DBH, schools, families. And I can tell you, we already have a waiting list of 8 referrals, and that's just from our 3 main providers. So there's, and again, that's just that age group of 18 to 24. So we have quite a long list of people in need of housing and programming. And we've really already experienced our residents, community friends being like, how do I get in here? What do I do? How do I get this help? You were able to do this for my friend that lives here. Can you help me? You know, so now there's a little bit just of a need of that process, but I'll have Lori make sure that she has my contact information so we can touch bases with you. I'd be happy to at least show you the resource center and the exterior of the building.
Great. Thank you.
Any other, Patrick, did you have a question?
No.
No, okay. And so just as a little bit of update where we are, like I said, we received a combination of 148, 149 grants. We're working through that process because the grant was awarded kind of in an odd year and odd timing. We'll have an extension a little bit into next year to kind of use all that process. And so we'll really get through that. Most of it, again, is all capital renovation and program startup. We also do have, we have received an award from the Department of Commerce. It's an interesting world. Like they don't quite know what it is because it's COVID funding trickled down to Department of Commerce, but yet Department of Treasury is the one to decide when and how it gets dispensed. So that notification hasn't been received, but that's again is specific for capital project. And then the grants we're really going to be seeking again coming up for this next calendar year is again accessing 149. The majority of that really will be for program support. There is a process around utilities, which really gets balanced sometimes with subsidized housing and sometimes not, just depending on the thread that those folks enter in to. Then we'll be looking in any Department of Commerce or HUD grants that may be available for transition housing, as well as I think in the future, once we have kind of really definition of 1590, how we can access those funds in really a long-term way to be able to maintain our program. And the gaps are probably right the same for us as they are for many in our community, but you know, our goal is prevention and intervention. We're really looking to have more on-site specialists. So we could have that really resource room available or accessed or opened on a regular basis at different times during the days, weeks, weekends, and nights. So it's easily accessible to that population that may be in school or not available to come at certain times of the day. Again, programming staff. Community education, I think, is a large part of kind of how we want to move forward, right? I mean, our goal is ultimately at the Pfeiffer House is that we want to eliminate homelessness for this population, which is a really big vision and goal. But I think that if we can build our community partnerships and assist with programming, education, and employment, we can create sustainabilities for these young folks, and they can actually live in our community and afford to live in our community and feel comfortable and healthy and safe in our community to keep them here. And, you know, and then of course, basic kind of administrative supports, like how we get through the cost of business is not cheap.
I did see that Apple had a note in the chat just saying that Apple, are you still on? That she has some resources she wants to make sure.
Yes. So Apple, I mean, I would love for you to share with me. We did connect our to-be mother with the Nursing First program, something I can't remember off the top.
Family partnership, great.
Yes, thank you.
That was a trigger. I wondered. So I know that a lot of my staff have engaged you, and we even had some of our school-based health center clinicians go and visit on open house, and they're really excited. So if they didn't have our programming pamphlet in hand, I'm happy to send you copies or send you the PDF.
Great. Yes, I would. I can come get them from you or both for sure. Yeah, we are trying to build up our resources, so it is a really easy access for young folks coming in to explore. Thank you.
So I invited Kelli here not just to inform us all about all of the good work that she's doing, but as I have been thinking about, we are now nearing the end of the first year of this grant, and John and I are very, very happy with the fact that we have managed to get through this first year without having to hire a grant coordinator, which means we have some funding that was allocated for that role that is available. And I would like to spin this funding back out into the community in a way that you all agree is a worthy way to do it. And because this group started with the idea of building a crisis stabilization center, and when we discovered that really wasn't feasible, we then turned to thinking, okay, so where can we start to address things at an earlier point before people are at a crisis, so that they don't get to that crisis point? Because we recognize if they don't get to that crisis point, or we head off more of those crises, that will be able to require less of our county resources, which really take the brunt of either our hospital or our jail of dealing with crises that aren't properly addressed, or we don't have a space to stabilize, etc. So as I thought about what Kelli had going, and I've been watching her go through building up this program, I wondered if I could ask this group, would you be all right, or give me permission to go explore with Kelli and her board of directors something that sits at the intersection of what they need and what this grant funds, this prevention, treatment, recovery aspect of what our funding is, so that we can create a project that would be probably a $40,000. That's about what we saved this year from not hiring a coordinator. Maybe we'd spread it over 2 years. That would go toward something that is needed there at the Pfeiffer House, that extends all of the work that volunteers have put in, that the county and city have put in terms of funding, other places that we've been able to get funding, just so we give this thing a really strong, solid foundation and sustenance budget to move forward with. And so I'm looking to you for a thumbs up or a thumbs down or questions about the process of doing that. See, I got one thumbs up. Patrick, thank you. Thank you. Double thumbs up. Is there anybody who has questions or would like to set up a time to talk individually with me or me and Kelli to sort of go through some questions that you have?
This is Dunia. I would love to talk from the hospital's perspective, and just, this is the first time I've heard about this, which is interesting because we funded the Pfeiffer House for 2.5 years. And so I'd be interested in hearing a little bit more, Kelli, from your perspective and where this is going. So please, Lori, if you wouldn't mind.
Yeah, I will absolutely set that up.
Thanks.
And Patrick, I see you thinking.
Well, I think I just answered my own question by thinking about it. These are program funds and they're not for capital improvements.
That's correct. It would be for programming, which is specifically around what this grant covers, which we're trying to tick boxes around prevention, treatment, and recovery. And personally, we're trying to address making sure that we catch people early before we need crisis stabilization. And I think both in terms of time point of how old these individuals are and the age group that we're looking at, that would absolutely meet with the purpose of this grant. Other thoughts or questions? Okay. All right. Thank you, Kelli. I really appreciate you coming and talking to us, and I'll be sure to circle back and get you and Dunia and I into a room together. And Apple, thanks for putting forward the resources that you have that we want to make sure are used to their fullest advantage. And Patrick, I'll make sure to connect back with you, get you connected with Kelli as well.
Thank you.
Thank you. Have a good day.
Thank you. Bye-bye, Kelli.
Bye.
Before we end here, we're at 3:55. I wanted to turn the microphone over to John Nowak. This is John's last meeting here, and he retires this month, next month. So John, tell us what you're thinking.
Well, I just wanted to take the opportunity to thank all of you who've participated in this work over the last several years, and just say how wonderful it's been to work with all of you and how much I've enjoyed getting to know many of you and learning about your interest in the community. And just something that, you know, is so reassuring to me is how many people in this community care about the other residents in the community and are working to try to make it better. And I think it's pretty easy for those of us that are the haves to kind of look the other way about the have-nots, but I really feel like that's something that's unique about this community, and I'm really proud to be a part of it. So from the bottom of my heart, thank you all for everything that you've done. And who knows where my future will lead. You know, I probably will see many of you down the road, but it's a good opportunity for me just to say thank you one more time.
Well, and from us, I'm sure I'm not the only one, but I am so grateful for the time that you've been here. We are happy that you're retiring, and we hope to see your face sometime in the future.
Yeah.
Thank you so much, John. We wouldn't be here without you.
Thank you, John.
Thank you, John.
Thank you, John.
Thank you, John.
Thank you.
Thank you, John.
Thank you, and enjoy.
Yes, please do. Okay, I want to remind everybody to read Lisa Thomas's email, which I can't remember what it said, but it's important, so go back and find it and read it. She's got some resources in there, and some of you we're going to see at this next meeting that starts at 4 o'clock. Thank you so much for being here. We'll see you next month.
Bye-bye.
Take care, everyone.
Bye-bye.